We are live. So, good evening, everyone, and sorry for the delay. I'm Archana Sharma, and I'm the founder of Samvedna Senior Care. And today I have with me Dr. Kislaya Dhar and Dr. Jayshree Das Gupta. So, we are going to talk about COVID, and I know there have been numerous. Every day you watch TV, and there are so many shows and talk shows, and so much to read in the newspapers about COVID. The reason we kept this session today was to demystify this, and we have requested Dr. Kislay to kind of simplify it for us to help us understand as a lay person, as people who are just anxious that are they going to contract COVID, as to what can be done. And today we have a different format also. So, so without wasting any time, I think I'd like to welcome Dr. Kislay. She's a MD in psychiatry, and she's a consultant with Samvedna Senior Care. And she's very passionate about geriatric care. I have also got Dr. Jayshree Das Gupta. Everybody knows her. She's our co-founder, and she is a clinical psychologist. So, good evening, Kislay. Good evening, Jayshree. Thank you for joining in.
Good evening.
So, let me just, let me just ask the basic question. So, like, what are the key symptoms and for COVID? I know we have heard about them, but my question is it possible that if you don't have fever, you could still have COVID?
Yes, that's a good question, because the most common ones everybody knows. Fever sabko pata hai, khasi zukham sabko pata hai, but you can have some other symptoms without fever, which will indicate that you may have COVID and would need to get tested, like headaches. A lot of people present just with headache, unko bukhar nahi hota hai, and diarrhea. Okay. That's a GI symptom, which again most people are not aware of. You just think your stomach is upset. You might not have fever, you're just having cramps and diarrhea, but you should think of COVID as well, and so should your doctor. Okay. Most likely they will ask you for a COVID test themselves. And then there is severe fatigue. That is बहुत ज़्यादा कमजोरी और बहुत ज़्यादा थकान लगना. That is also a symptom of COVID. Most people will have the weakness with a fever, but it is quite possible that you may have a very low temperature, which you are not able to pick up on. And you've actually caught the infection. And last but not the least, something everybody should watch out for without fever, without headache, is a breathlessness. Supposing आप घर में you were able to climb a flight of stairs, but अब आपकी सांस फूलती है. Something you were able to do earlier, now you're getting breathless. Do think of just going for a checkup. There's no harm.
Okay. So let me come to the testing part, Kislay. There are so many tests, and every day I read in the newspaper, antigen, antibody, RT-PCR.
Yes.
I try very hard to understand. So, what is your comment on this? What is the prescribed test, and how do these work? If you could shed some light on this.
I will try to simplify it a lot. Like you're saying, every day there's something new in the paper, and वो पूरा explain करने की कोशिश में बहुत confuse कर देते हैं. So, with the caveat that we don't really need to understand test कैसे हो रहा है, lab में क्या हो रहा है, आपका sample, once the sample has been taken from you, what is happening with it later, we don't really need to know it. But it's good to understand किस चीज का test हो रहा है और आपको report कब तक मिलेगी. So, the final deciding factor is your doctor. As you mentioned, the two tests, the RT-PCR and the antibody testing, or the serological testing as we call it. To really simplify it, one is testing for the organism in your body which is causing the disease, and the other is testing for the response of your body to a potential infection, which may be at any time of the infection. वो past infections भी test कर सकता है. So it's not necessary that you still ill or you're infectious. You could be completely recovered, but you would still have antibodies. which ties into another thing is the plasma therapy that everybody wants to
today
know about.
so much talk is going on about it.
Yes, so the antibody testing actually helps us with that. जो plasma donate करने जा रहे हैं उनके plasma से हम antibodies actually expect कर रहे हैं. That is what we want to give to the next patient to help them fight the infection better. So RT-PCR tests for the virus. उसको हम बढ़ा के उसका core DNA जो होता है, the virus has RNA in it, which is translated into DNA, and then the DNA is amplified, and we test for that because the quantity increases and you're able to test for it. Virus, as we all know, again, we all know the size also of this one organism. It's really small. It's in the microns. So to test it is very hard, which is why you need something like RT-PCR, which is actually dependent not just on the sample you're getting, but on the kind of lab it's going to and the trained person that is doing the test. You need very well trained people to actually do it properly. वो 3-4 स्टेप होते हैं, उसमें से एक भी गड़बड़ हो जाता है तो RT-PCR आपका नेगेटिव आ सकता है, although you might have the virus particles in your body. And antibodies are relatively simpler, easier to conduct, and they will start testing positive 3 to 5 days after the infection, क्योंकि आपके बॉडी को उतना टाइम लगता है फाइट बैक करने में और एंटीबॉडीज प्रोड्यूस करने में.
Okay, well, that's very useful. And so, if I'm suspecting and like that I may have contracted the disease, during this time when I'm waiting for my test results, should I isolate myself?
Yes, of course. There is no doubt about it. उसमें 2 बार आपको सोचना भी नहीं है. Let your doctor decide whether they want to do an RT-PCR, whether they want to do an antibody testing, whether they even don't want to test you. That is your doctor's decision. But if you suspect you have come in contact with someone who may be infected, आपका sample जाने वाला है, तो जब से आपने फोन किया है sample को भेजने के लिए, till the time your report comes, please isolate yourself in the house, just to be on the safer side. You could be asymptomatic, like we said. हो सकता है आपको कोई बुखार नहीं है, कोई सर दर्द नहीं है, कोई symptoms नहीं है. But you've come in contact with someone who's positive, you may have contracted it, your body is beginning to fight it, but in the 5-6 days that you may become symptomatic, you're going to infect all the people that you meet, because this is a very easily transmissible disease, as we are learning. So yes, please isolate.
Okay. And what, like, it's a related question, and I'm not throwing any tricks at you, but like when do I know that I need to get this test done? Because some people have fever, so they are waiting. Maybe they wait 4 days, 5 days. Like somebody had it here in our complex, so they waited for 3-4 days before they finally rushed at night when the fever started getting very high. But that is one way of going and getting tested. And I know there are limitations from the way the testing happens also. So, what is there any answer to this question? That what is the best time to go for that testing?
You're actually framing the fear in people's mind in the format of a question. So yes, one way is to wait for the fever to become really high and then you get scared and go. The best way is, if you suspect you've come in contact with someone who may be COVID positive, please call a lab or a doctor. They will guide you better. Second of all, as you said, now this is a policy and a governance matter, which obviously we can't comment on. Guidelines keep changing. किसको टेस्ट कर सकते हैं, किसको प्रिस्क्रिप्शन दे सकते हैं, कौन दे सकता है, कौन सी लैब कर सकती है. It's all very fluid, which is why
it changes every day.
It's best to reach out to your primary care physician or a lab when you think you've come in contact. Secondly, as you're saying, and this I've noticed in people I've known and the patients that I'm working with right now, there is a fear. As I said, you've addressed the fear कि हम कोविड पॉजिटिव ना निकल आए तो वो टेस्टिंग डिले करते हैं. That is not helping anyone. I'm sorry if you're getting infected, but it helps if you get tested and prevent that infection from going to 5 other people in your house or your friend circle, rather than just postponing it, thinking कि अगर positive आ गया तो, अगर आ भी गया, there are protocols in place to take care of you. And if you're negative, at least you know once and for all. So if you have a fever, please don't wait beyond a day or two to contact someone. If testing is not required, at least you will know and you will be able to say, I was told not to get tested, so I'm not being irresponsible. Let's be responsible, not just with ourselves, but the people around us.
Sure, sure, sure. And once someone is tested positive, what are the immediate action items? I know before, like, what is it like? My question is that should I immediately get my house sanitized, or should everybody in the family get tested, which happens, but like, that is recommended. I mean to say that is a sanitization recommended immediately, or can it wait? The testing obviously has to be done first.
Testing has to be done first. The sanitization is actually more a personal choice right now. Thankfully, it doesn't come in the guidelines, so I don't think there's any harm if you're able to call someone who can do it safely. Call someone to sanitize the rest of the house, and while you isolate in one room if you have the space, or go to a government quarantine center if you don't have the space. It's minimizing risk. It's not going to completely take care of everything that you may have touched, or if you've already transmitted the infection. But on that particular day, whatever you're touching, whatever may be infective, वो sanitization से ठीक हो जाएगा. आप किसी को बुला भी नहीं सकते, तो आप खुद कर सकते हैं. Things like food, plates, papers. You could just spray sanitizer and wipe it around the patient, whatever they may have touched that day. Once you start suspecting, and then let them isolate. So that is one thing. And the second is again a policy thing. Whether the whole family should get tested. The doctors will decide. The lab will decide depending on the availability of the test and how serious it is.
Right. And also there's this whole, discussion around false negative. So you're not testing positive in the first instance, like our Delhi health minister did not test positive first.
Yes.
And then on a repeat test, he did test positive. So thankfully, we are happy that he's now back, is better, and he's probably going to be discharged. But that can happen. And what is the, like, even if I've tested once, then what is the frequency at which I need to get tested again to confirm that I'm now safe?
Right. So the second part of the question, unfortunately, doesn't really have an answer right now because research is ongoing. We're still learning a lot about this virus. The first part, yes, you will not test positive in the first 4 days of infection, which is why I'm saying the minute you suspect, isolate. वो आपका sample लेने भी चौथे या पांचवें दिन पर आएंगे. Because as I said, antibodies are not produced immediately, and that is the easier, more reliable test to be conducted. False positive is if you're testing positive for the infection, but आपकी body में infection नहीं है. This can happen because of cross infection. At the end of the day, it is a coronavirus, which is a respiratory virus. तो कोई भी अगर आपको seasonal flu भी हुआ है, उसके बाद आप test कर रहे हो, you could be testing positive for that virus, but you think it's a corona positive. So that is a false positive. It is a possibility. So in this case, we'll repeat the test after 3-4 days again and test for this particular one. And second is the false negative. Like in the case of our health minister, he did have the infection, but maybe the antibodies were not being produced. We tested him too soon. He got the test on the first or the second day, so he tested negative. But on the third and the fourth day when he was tested, he was positive. So this will happen depending on the timing of the test and the kind of test you're going for.
Okay. Okay, so I think I would like to invite Dr. Jayashree at this time also in this discussion, and maybe I know that you have some questions related to home quarantine which you would like to address with Dr. Kislaya. So over to you, Jayashree, and you can you can share your thoughts and bring up your questions.
Thanks a lot, Archana. So, Dr. Kislaya, I know we've been talking a lot about home quarantine, isolation. It's one of the things that we've been asked a lot is what are the kind of precautions that family members should take if someone is home quarantined? What do they need to do?
Stay away. I know it's very hard. It's very difficult. You want to take care of them and you're constantly worried. But the best and most efficacious way of preventing that spread of infection is maintaining distance and washing your hands or sanitizing the surfaces around the patient. Which is why the strict guidelines are in place कि वो एक अलग कमरा और एक अलग टॉयलेट होना चाहिए उस पेशेंट के लिए, which is when you will home quarantine. Otherwise, you will go to a government center. आप खाना बाहर छोड़ सकते हैं and the patient will wash the plates and then give them back to you to even further reduce the chance of infection. And at minimum, please maintain, up to 2 meters of distance because that is how far the aerosols being generated by that person talking, coughing, laughing are going to spread. So distance, distance, distance. If you have to go close to them, please mask up and wash your hands when you're done coming out of the room. Sanitize yourself before you go meet the other members of the family. What will help in this, again, very difficult, is if only one person takes the responsibility of caring for that one patient in the house.
Right, right. So that's really useful advice, I think, because that's something which we've been hearing a lot about. But as you're mentioning, it's very hard for family members to implement it. But I guess there's just no getting away from the fact that distance, as you said, is the
Yes,
most important thing they need to follow. But
it seems to be the hardest part of this disease, but we have to follow these rules.
absolutely. What about the patient? What kind of measures should the patient take if they're home quarantined to
Uh,
protect the rest of the
yes.
family from contracting the infection?
The patient has to contribute to not stepping out and intermingling with the family, break the chain of transmission, monitor yourselves very carefully so that you know when you may need to be transported to the hospital, and so that you can keep updating your doctor on a daily basis. If not, at least twice a day, your vitals should be getting taken. Keep your clothes separate, keep your utensils separate. What you're eating, if you're leaving something unfinished, don't send it back into the rest of the house, because your saliva is going to be there on it and somebody might take it or somebody might touch it. You can't predict these things. These are very small things that we need to be mindful of at a
Mm,
time like this. And it's if you're feeling very very weak and you're not able to wash your clothes, then leave them away for 24 hours before somebody else comes and picks up and does the chores that you're unable to do
right.
yourself.
Yes.
So these are small things that the patient can do to make sure he or she doesn't spread it to
Mm.
the rest of the family. And most importantly, the patient can take care of themselves so that the other family members are not worried about you so much that they keep feeling the need to, poke their head in and अरे बस पूछने ही तो जा रहे हैं, अरे बस एक बार देखने ही तो जा रहे हैं.
Right. I think that's the challenging part. But as you're rightly mentioning, the important thing I think for all families to remember, if there is somebody who gets detected in the family, is that everybody has to chip in to
Yes.
contain the infection. But what's the ideal duration for which one should for home quarantine or isolate?
Isolation would be if you're suspecting you got it from someone or you've come after traveling. Again, this is something which is a little tricky to answer because the guidelines have been changing from 1 week to
Right.
2 weeks to 3 weeks, back to 1 week to 5 days. It's very difficult. Second,
Mm.
there will be a difference between if somebody is a healthcare worker and they're working and coming back, the quarantine period will definitely be longer because the chances of exposure are higher. And whereas somebody who's just gone grocery shopping and you think you've met somebody who might have been infected and you're quarantining, the incubation period, so far as we can tell till now, has been predicted to be between 2 to 3 weeks. So if you're quarantining yourself for at least minimum 2 weeks, you should be out of the danger period. Of course, these are very fluid things which are constantly
Mm.
changing.
Right, right. And again, you were mentioning that it's very important to sanitize the environment if it's possible. What about waste disposal? Any tips or guidelines that you could share with people for that?
Right. So the most important thing to dispose of right now are the masks, because that is
Mm.
what is catching the droplets and the aerosols and getting wet and going to be the mode of spread further down the road. Whereas the other things, like I said, clothes, packages, utensils, obviously you're not going to throw them and keep changing them every time someone's using them. But you can take precaution. If someone's infected, leave them alone for 24 hours and then take it out. If someone's not infected, then when you're stepping out, when you come back, we're all probably doing it. But you can be a little more careful about changing your clothes, taking a bath, throwing them in the hamper,
Mm.
shutting the hamper. And if you're disposing the mask, making sure it's in a plastic and inside a dustbin and a shut dustbin, because that will
Mm.
generate aerosols and then आपकी सारी मेहनत waste हो जाएगी. Whereas the
Yeah.
other garbage in the disposal is regular disposal. Thankfully our sanitation workers are coming and garbage is being disposed of. Masks,
Mm.
on the other hand, are a little more difficult. It's a biomedical waste. Ideally, they should be sent to the hospital, and the hospital will further segregate it and dispose of it in that manner. Unfortunately, we don't have those guidelines yet. But what we can do as citizens is make sure we don't build up waste.
Mm.
Uh, Segregate your masks together, put them in a polythene. They should be either buried or incinerated or sent to a hospital to be disposed of later.
Right, right. And I think, I mean, thank you for highlighting the kind of things that we can do as responsible citizens, because I think that these are really important and useful pointers. So thanks a lot for that, Dr. Kislay. Um, what about when a person recovers from COVID? I know a lot of people have been asking us this. Can someone get the infection again?
This is not very certain. People have tested positive 3 months after recovering. So they tested negative, they were let go from the hospital, they came back home, they were feeling absolutely fine. And because of the, epidemiologists went and they wanted to study the spread in the community and tested these patients again, they turned up to be positive. Now we are
Right.
not very sure whether they're testing positive for the antibodies, which means you become immune to the infection, or are you testing positive for the viral particles which are persisting in your blood. Now, the viral particle can be a dead piece of the virus, which is being picked up by the test and you're testing positive, but you're not infected by a live virus. Or if it is a live virus, which is whether it's reinfection or the infection went dormant and you're being, it's resurgence of the infection, we are still not sure. We need to find out more about that. We're still studying those things. So most importantly, again, for people like us, if you've been infected, if you've recovered, you want to donate plasma, please go to the hospital. They will check you anyway. And if you get the symptoms again, do get yourself tested and we'll learn more about the disease.
Right.
Yeah.
And I think that's really well highlighted. That I think there are lots of changes, lots of new things that we're learning every day about the virus. Because yes, this is something that's very new for everyone. We don't
It
unfortunately
is
have
a
all
long
the answers that we would like to.
We're learning as we go along.
Yeah, so I guess we all need to do a bit as responsible citizens. But now that the unlock phase is, we're in the unlock phase, and we're still trying to maintain social distancing. We hear a lot of people asking that they're going to buy groceries, out in the markets, and there are too many people in the either inside the shops or in the marketplace to actually practice this. 1 meter safe distancing that's being advocated. What should one do in those kind of situations?
Wear a mask, wear a mask, wear a mask. Wash your hands, wash your hands, wash your hands. Uh, it's not just about shopping, it's actually about India. Our population density is such that even in the least crowded of places, आपको फिर भी 4 लोग दिख जाएंगे who are standing close to you. So mask
Right.
up, always wear a mask because it reduces transmission by 80 to 85%. Which is a lot in this infection. And whatever you're touching, whatever outside of the house, if you're touching things, it's, these are in unconscious things. We all touch our face. We have to unlearn touching our face and learn not to touch our faces. Now that's very important because you have the maximum risk of infection from your face. We rub our eyes, you touch your nose, you touch your mouth, and all of this makes the virus go inside, which is when you get infected. So avoid touching your face while you're outside the house. Wear a mask, be careful, maintain distance if possible. If not, come back, dispose of the mask properly without touching the outer surface and holding in the inner surface so that whatever you have excreted remains inside. Then fold it again and dispose of it in a shut dustbin.
So I guess it's also very important about how we dispose the masks, how we kind of take that
How you
responsibility.
yes, how do you put it on and how do you take it off? Now, most people, unfortunately, in Delhi, most people are not even wearing the mask over their noses and mouths. It's around their neck constantly. I'm not sure who it's protecting or who it's for. So make sure it covers your nose, make sure it covers your mouth, and when you're taking it off, hold it by the strings and not the surfaces on either side. Fold it in a manner that it doesn't expose somebody else. Make sure it's in a dustbin which is closed, and then wash your hands immediately. If you don't have a sanitizer, please wash your hand. If people ask me if they can make their own sanitizer, please don't. Just please don't. It shouldn't even be a question. The soap and water are always going to be more effective than any sanitizer you can use.
Right. Very well said.
So, and these guidelines also then hold, if you're in the workplace and you're, working in a cabin, we have as people are going back to work, the number of people going back has been staggered. Do you still need to wear a mask if you're in the workplace? Working in a cabin with one third of people
This
in the
is not going
office.
to be a very popular answer, but yes, if you're out of your house, if you're not in a sanitized space, please wear a mask. It's always better to be safe than sorry. Especially as I'm saying repeatedly, अभी हम इस बीमारी को ही नहीं पूरी तरह जान पाए हैं. New symptoms are coming up. New, people are suffering from new things that we don't know. Joint pain, skin rashes. अभी तक हमें नहीं पता था, अब हमें पता चल रहा है. So it's definitely better to be safe than sorry. If you're sitting in a cabin, yes. While you're in the cabin, if it's not in air-conditioned space, your office, because now air-conditioned spaces will have a higher risk unless they've been modified with the new filters to remove the bacteria and viruses, because the same air is getting circulated. So regardless of whether your cabin is separate from the rest of your workers, you're still getting the same air. So it's always better to just keep the mask on. If you have the modified ACs and you're feeling a little, more confident and you're more of a risk taker, take off your mask by all means, but please sanitize every time somebody comes in. Put on the mask when somebody comes in. Ask them to wear a mask and sit at least 2 meters away from you. Have your meeting and carry on about your day.
So really, really important to wear that mask, use the sanitizers, and maintain distance. So I think these are the key things that you've been highlighting. Another thing that we often also get asked is every time someone steps out of the house for any sort of an errand, should they come back, take a bath, change? Is that something which you would advise people to do?
It's very difficult. I know it's a lot of us are very lazy and we're not used to this new behavior pattern. But like you yourself said, when we step out, India is so crowded. I don't think we can even step out on the road in front of our houses and not see at least 3 neighbors going for the evening constitutional or just disobeying rules. And now that unlock is happening, most people think it's fine and it's safe and they're out without a mask. So if you're standing close to people, you're talking, you don't know where the droplets are landing. I think, again, better to be safe than sorry. Wapas aaiye, kapde badaliye, naha lijiye. And if you're not feeling like washing, having a bath, at least wash your hands, wash your face, wash your feet, and then get into the rest of the house.
And again, as you've been highlighting, these are things that we all need to do as responsible citizens. I think these guidelines are out there, but as you were mentioning, there are people who are still taking risks, and it's important to remember we don't unfortunately know enough about the virus. So better to be cautious and follow some of these safety tips that you've been highlighting. As again related to as we start getting back to our normal lives, when we're traveling, through different modes of transport, like cabs or whatever, what are the kind of things we need to keep in mind? How do we stay safe?
I'm going to be very unpopular by the end of this. Please don't travel if you don't need to. It's too soon. I know we are unlocking and the economy needs to get back on its feet. But if you have elderly at home, if you're at high risk or you have kids at home and it's not necessary, then there's no need for you to be traveling. Of course, if you have to go to work and there is essential travel involved, avoid closed spaces for too long. Any place without cross ventilation will be more prone to build up of the virus concentration in that space if even one infected person is in that space. So like air travel, a lot of people want to ask that because they want to get home or they're going to work, meetings are starting and they need to travel. Yes, airlines are taking all the precautions they can. They're giving you the PPE kits, they're testing you, they're asking for certificates, but they haven't stopped the middle seating. There are 3 people sitting side by side. So there is no social distancing inside an aircraft. And even if they've modified the air conditioners, it's still the same air that's being recirculated and you're breathing it in, regardless of your mask, regardless of your face shields. So you can take more care, more precautions by using a better mask while you're traveling, especially if it's a longer journey. Making sure you're not eating food from whatever's being served or buying it from, not certified people. Don't share water bottles. Very important. I know we have the habit, everybody is very friendly and you want to share water bottles, you want to share food. Try avoid doing that. And the minute you get to your destination, removing all your external covering, preferably having a shower, but washing your hands and washing your face, and then carrying on with your day with a new mask on to protect other people. Of course, right now, I think the quarantine rules are still in place if you're going on interstate or interstate travel. But within the same city, if you're going on a longer journey, if you're taking 6 hours to get across a state to get to another place, quarantine yourself.
Right, right. No, very, very important information that you've been highlighting, particularly about, I think we really need to decide what's essential and non-essential travel. Actually, I wanted to check if there are any other questions that you would like to ask from any of the people who joined us.
So I have a question here. I think the answer is very obvious, but any suggestions or advice for senior citizens for going out if required? If required. So
okay.
Some of them are living alone, so they have to probably go out.
Well, I really hope all our senior citizens are safe, because you have somebody to do those errands for you. If not, please call Samvedna. Again, it's not a very nice disease because you have to pick and choose. So there are younger people who are less at risk. So, we will step up and come and do those things for you. If possible, avoid it altogether, especially right now, because we are in a stage of such rampant spreading of the infection that we don't even have an idea of the real numbers. So you don't know. But if required and you really need to go out, then please take all the precautions from head to toe. Use your own transport if preferable. If possible. If not, use a cab with just the driver and you sitting behind so that there's some distancing, a shield in between. Use a face shield and a mask. Carry your sanitizer with you. Very important. Carry your food. Carry your water wherever you're going. And once you reach your destination, everything that I said, unmask or remove your clothing in the correct manner. Wash your hands. Put away the containers that you were carrying with you, and then step into the house of whoever you're going to visit. Because again, yes, you may be at high risk as a senior citizen, but you can also spread the disease further.
Right. So there is a gentleman here who is in Sydney and watching this program. So he's probably stuck there. So he's asking, when can I come back to Gurgaon? So I don't think you can answer that. Today I just read in the newspaper that
scientifically. So
flights are not going to open before 15th of July, right? So sorry, sir, I think we could help you with this question, but there is, I don't think we will be able to advise you on that. And even if it opens, I think you may want to take your time to travel.
Definitely. Especially if you're a senior citizen, sir, one kind index I can sort of give you is look at the numbers in Sydney, the rate of spread. Obviously, the population density is lower there, and look at the numbers in Delhi. And the next would be your chances of getting the kind of help required. Khuda na khasta, unfortunately, if you do require that, would you be getting better care there or here? And how fast would you be able to access it? Look at those two things and then make up your mind. Of course, at the end of the day, home is home. Everybody wants to get home.
Absolutely. I know. And there are a lot of families right now who are not at their homes.
Yeah.
So,
but that's in every house. We're not alone in that either. Not that it makes it better, but it's just good to know.
Yeah.
Misery loves company.
Definitely. Yeah, Deshree, please carry on. I didn't mean to interrupt.
And another question that we get asked a lot, and you've been talking a lot about the importance of wearing masks. What type of masks should people wear? Are there different kinds of masks that different people should wear, or what advice do you have on that?
So starting off, just to clarify very quickly, again, now this is something, information is everywhere. First and foremost, please go to the right sources for your information, like about the type of mask, the kind that we should be wearing, the kind that the frontline workers are wearing, and infected patients should be wearing. So in India, the ICMR website and the Delhi government, each state's government website gives you the exact information and the good, reliable information, so to speak. So you have surgical masks, which are disposable masks, which increase the waste that you're generating at your house. Avoid those if possible. And the reusable and the rewashable masks are the ones I get the maximum amount of queries for, because they're cost effective and they're reusable. So you're not generating waste and you can actually keep using them. And then finally, we have the N95, which is 95% effective in not letting in bacteria and viruses. But those, as has been said time and again, please reserve them for your frontline workers, for the healthcare workers, because they need it more. If you have a patient at home, on the other hand, an N95 will definitely help because it prevents cross infection. But in your daily activities, going out, if you're going to a very crowded place, if you're going somewhere, or as we were talking about earlier, आप travel कर रहे हो, कई घंटों तक कहीं पे बैठेंगे, up to 6 hours, you can use a surgical mask. It's a one-time use mask. You can use it for 3 days if it's not torn or infected, and then dispose of it. So use that. But in your day-to-day activities, घर में पहनना है, या you've gone to pick up groceries from a nearby place, or people are taking walks, you can wear the cloth masks or the masks which have a sponge layer in between. It increases its efficacy, but it still remains washable and reusable.
Okay, that's really useful information, Dr. Kislay. And again, you've highlighted that one thing we need to be very mindful of is how we dispose these masks whenever we use them. So that's just something that's very important for us to keep in mind. I just want to ask one question, as I know we're nearing to a close, but what are the latest updates on drugs for the virus?
There are no latest updates on the drugs for the virus. There are combinations and permutations being tried frantically by doctors across the world. Some work better and some don't work at all. And now we have conflicting data. So I can get really technical and go into depth of it, but of the maximally accepted guidelines right now, what most doctors have practiced and we've seen a benefit in patients, is to keep your fever medication at home, like a paracetamol, which works. Then recently there was a furor about steroids being the miracle drug. Please don't stock up on steroids. Please do not start them on your own. They have many, many, many side effects, like the hydroxychloroquine, which in the beginning part of March was so hyped. It's an anti-malarial drug. Again, it has side effects. So unless you've been advised by someone, please don't start these medications on your own. Right now, the best options we seem to have is the plasma therapy, the steroids given in the hospital, and the IV antibiotics and antivirals, which you need to be in the hospital to receive anyway. So again, please don't take any IV medication at home, because you could have severe side effects, which you would need a doctor to be by your bedside to help you with. As far as drugs go, if you do want to be prepared, now I know a lot of people have already done this. If you can afford it, great. If not, like maybe resident welfare associations have gotten together and provided it for their members. A pulse oximeter helps to monitor the oxygen in your blood. This is very helpful, since that is the one thing we know for sure about this infection. And keeping antipyretics, that is the fever medication, at home, and keeping your cough and cold medicine at home, just to make sure you're not catching the seasonal flu and then going and panicking everyone around you.
I have a related question to that. So, like you you said it, that we can have some of the antipyretics and some of the cough and cold medicines, and we should avoid self-medication, right? I mean to say, we should not start any antibiotic course if we feel that we are probably going to we may be a suspect. Am I right?
Absolutely not. And again, you're asking the wrong person. As a doctor, I'm never going to say please self-medicate. Not at all. क्योंकि लोग पैरासीटामोल खाते खाते उसकी टॉक्सिसिटी कर लेते हैं. So even a simple drug like that, I would professionally recommend just get a prescription. It's not that hard. There's telemedicine, there's online consultations, there are labs that you can call, and they give you like a printout of what you need to be doing, which drugs you should be taking. And what you can do on your own is keep yourself very well hydrated, keep your immunity high, keep your mood elevated, because stress has a large role to play in immunity. So those things at home, all of us can do.
Right. Which now brings me to the last part of our Q&A discussion. I have two mental health experts with me. So how can we cope with this, this added stress. And then there is this lingering stress कि मुझे हो तो नहीं जाएगा, So, so like today we discovered that we probably were in contact with somebody had just now been diagnosed with COVID. So we are all like worried what's going to happen now, what should we do. So I don't know whether the fear is unfounded or we should be cautious. And how do you deal with all this stress, Jayashree? I don't know.
I think at least something that I think is important to keep in mind, and as Dr. Kislaya has been highlighting, that if you feel you have come in contact with somebody who's positive, definitely take precautions, isolate. So in a way, there's a positive part to fear. If it's a real fear, it's out of something that's actually happened. There's a likelihood that you've been in contact with somebody who's positive. Follow the precautions, be responsible as a citizen, take the kind of steps that Dr. Kislaya has been talking about. If it's something, if you're watching the news updates and you're hyping yourself up about, some symptoms that you're feeling, again, stop taking those constant updates. If that helps you feel better, that's a good thing. You probably, that's probably the source of where that anxiety is building up from. So we need to kind of be a little rational in trying to understand where those fears are coming from. Is it something? Is it based on monitoring, watching news? Or is it something that actually, as you were mentioning, a real fear? And take steps accordingly. Dr. Kislaya.
Yeah.
First of all, yes, as you said, ma'am, we need to know where the fear is coming from and whether even if it's valid. And what can you do about it? Secondly, coming in contact with someone who knows someone who's tested positive right now, trust me, you're not alone. Everybody is a second or third degree contact at this point, whether we want to admit it, whether our government wants to say it or not. It's happened. So I'm sure all of us know one person who's been testing positive and at least one person who's come in contact with someone who's tested positive and you've come in contact with them. So there's no avoiding that. Secondly, as you said, if you are suspecting and you're afraid whether you'll get it, the most important thing to do right now is quarantine your whole family for the next 2 weeks. Mm-hmm. And, be responsible about it. As hard as it is, again, we like to reach out and have our fears assuaged. The third thing, now this is something simple that we can all do at home, as I was mentioning earlier, the breathlessness. We can do a sort of test for this for the next 2 to 3 weeks. If you don't develop a fever and all, you're obviously in the clear. If you don't get any symptoms, that's great. You're free and clear. What you can do is do your regular activities and watch for anybody in your house getting breathless. That would be your first indicator that, yes, maybe you've got an infection in the lungs and you would need to get it checked out. And then, of course, your doctors will guide you with an X-ray or the blood test, whatever you may require. Secondly, if there are high-risk patients in your house, somebody with comorbidities or even, senior citizen, then maybe isolate them further so that the people who did come in contact with this person who came in contact with somebody who tested positive, they can sort of maintain distance for the next 7 to 10 days. Make sure you're in the clear and then continue interacting as always.
Yeah. I guess it also requires a lot of motivation, self-motivation for everybody to stay in quarantine. Right, Jayashree? Any last thoughts on that?
I know it is very hard to follow some of these guidelines, as simple as they may seem. Definitely, I think it does require a lot of self-motivation. But again, as Dr. Kislaya was highlighting, these guidelines and these, are there for a reason. It's to minimize this spread. We don't know enough or as much as we would like to about this virus, and therefore need to follow these kind of precautions. That itself should, be you need to remind yourself that should be your motivating factor. To stay safe and protect those around you who, rather than put them at risk. So definitely self-motivate. I think it's something that as a family, if you're with other family members, you see someone else's motivation levels going down, somebody in the family becoming a little fed up and, think, "Yaar, chodo, bahut ho gaya. Let's just get back to things the way they were before." You need to help boost each other's motivation levels up. You need to be responsible, remind each other, that no, we need to keep going at it because it's for the larger welfare and good of everyone in the family. So self-motivation, motivate others around you as well.
Great, great. I know we are almost at the end of this session, and if anybody has any questions, you can type it in. We'll try to take it. So, like, there's a question, Dr. Kislay, that tomorrow we have to attend a family marriage. What precautions to take? So
that's great. Someone's getting married, but okay, I can't say don't go since you're saying you have to go. But is it necessary that everybody has to go? Is it possible to send a representative who will, represent the whole family there, so that everybody doesn't get exposed, and then it's easier to isolate that one person when they come back rather than all four of you staying together and running that risk? And if even that is not possible, then the mask and a shield and 2 meters distance from everyone, as hard as it is in a wedding, because I know we're all missing hugging our friends and, shaking hands, simple things. I'm a doctor and I forget to wear a mask. So trust me, I know it's not easy. I have to be reminded again and again before I step out of the house, like, where's your mask? So it's not easy, but like Jeshri ma'am was saying, motivate yourself, motivate others. And it's okay to forget once in a while, but it's not okay if you're running the risk of infecting other people who may be more vulnerable than you and who unfortunately may not be able to access the kind of care that we can. We are all here talking about this, feeling a little better about ourselves and our own fears and going away. There are a lot of people who don't even have access to that simple platform. So if we go and infect them, I would feel really bad. So please take all the precautions if all four of you have to go in the middle of the day for a wedding.
Yeah. It's a very good question, Dr. Kislay. So it says if you have caretakers coming on 12 hours for an old parent, and this is a real situation. I mean to say, this is a problem situation actually. So what precautions can you take? Because
this is a very good question. Now this is something I'm facing myself. My elderly grandparent needs to have a caretaker. But luckily, I have found a solution. So maybe you could try that. If possible, get your caretaker to stay back. Stay with you for 2 weeks and then go and quarantine themselves for a week or 10 days with their family and then come back. Barring that, if that's not possible, if you can't have two people doing this in rotation and that one person has to come for 12 hours, then you can give them a separate set of clothes when they come from wherever they're coming. And they have to be masked up the 12 hours that they're there, because you don't know where they're going, unke rehne ki jagah pe kya situation hai, who's infected, not infected, what prevalence of spread is there and the viral concentration. So when they come, they change their clothes, they mask up, they wear a shield, they sanitize, and then go to your elderly relative, finish their work, and at the end of the day, they follow the same precautions. Remove everything properly, sanitize, wear their clothes, mask up again, and then get home so that they're safe during the commute. And you're minimizing their risk of exposure even during the commute before they get home, and do the same things again to protect their family further. That's the best you can do. I know it's unavoidable.
Right. Okay. Well, thank you for sharing that, Dr. Kislay. I think we are almost running out of time. Unfortunately, we took about 7 minutes to log in. We have a new format, but I think this is a nice format. People can see each other, and it's more interactive. We'll keep coming to you in the next few weeks with some more topics and discussions, and stay tuned. And thank you all for joining. If you still have questions which did not get answered, please don't hesitate to type it in. We will revert to you, even if it's in the comment window, or we can even you can share your email with us and we'll revert to you on email. Thanks, Dr. Kislay. Thank you, Jayashri. Thank you so much for joining in. Thank you, everyone, and have a good evening and a good weekend. Make the most of it sitting at home. Make some nice goodies and enjoy your weekend.
Yes. Stay safe, everyone. Thank you.
Yes. Yeah. All right. Thank you.
Bye-bye.